The issue of healthcare in America has been subject to contentious debate. Providing for individuals with adequate and affordable care while at the same time staying true to the capitalist system of America has proven an issue very difficult to solve. The interests of the consumer, the insurance provider, the medical provider, and the government must be taken into consideration when deciding what to put into a healthcare reform bill. A balance of all these interests is difficult to reach, and any attempt tends to alienate at least one group in one way or another. In fact, according to Davis, the United States is ranked last in healthcare when compared to other top industrialized nations. By no means is healthcare in its current state inexpensive or even affordable. From hospital visits to simple checkups, the cost of healthcare has continued to rise over the past decades, unchecked by inflation. Insurance, along with public programs such as Medicaid and Medicare, help bring down the cost for the consumer, but quality medical service is still beyond the realm of possibility for some individuals. A fully private system, close to what is used now, results in high costs, on the verge of price gouging. A fully public system raises taxes for all citizens, regardless of their need, and puts a strain on the federal budget. In either extreme, citizens are put upon beyond what many deem is to be fair. Insurance companies and healthcare providers are the source of thousands of jobs throughout America, but some of their practices are deemed exploitative by the general public. The idea that pre-existing conditions can inflate insurance costs has been an issue as it locks away insurance from those who need it most. Changes are being made to make insurance more available to those in need, primarily through bills like the Affordable Care Act. However, it is high charges for procedures leveraged by massive hospitals and healthcare providers that create the need for insurance, and both of these services are a great drain on the average person's financial abilities. According to the American Medical Association, pruning these systems in any noticeable way would result in the loss of jobs and potentially a disincentivization of the healthcare field. Additionally, according to the American Medical Student Association, any action against large corporations would echo down to smaller, family doctor practices or Main Street insurance groups. Both insurance and healthcare have a great deal of sway with respect to lobbying, and the public is split for and against the status quo. Finally, the federal and state governments that regulate healthcare programs like Medicaid are put in a somewhat difficult position. Partisan politics make it difficult for the legislature to make a unilateral movement to fix the system as it stands. With two parties differing on the type of reform required, representatives need to stick to party lines to hold their position. Any program that can be instituted to fix healthcare will offend many interest groups. There really is no safe route. To engage in a government-funded insurance program would require restructuring the already precariously balanced budget and would require a radical change in how individuals and businesses are taxed. Both of these things would be a clear threat to the permanence and stability of the political system. At this point in time, America finds itself at a crossroads in the future of healthcare. Many powerful groups, including the public and the government itself, must be united despite their conflicting interests on how the nation can move forward. People, humans, need a stable source of health services to thrive and continue improving the nation. In short, an uncertain future filled with compromise, and indeed a level of dissatisfaction for the parties involved, needs to be solidified so that America can be the best as it can be. The single-payer healthcare system has many benefits, including guaranteed healthcare for all Americans, the elimination of the pre-existing condition, and a reduced cost in many cases, in many cases, better healthcare than was provided before. According to the Physicians for a National Health Program, one of the most important features for the single-payer healthcare system is its ability to provide insurance for all Americans, no matter their financial situation. Under this system, the single payer, in this case the government, pays for all healthcare costs. This means it does not matter how much money you make, what ethnicity you are, or especially whoever you are. This would also help combat a major problem here in America, where the care you get is based on how much money you have. The individuals with more money are able to spend it on high-end facilities to help themselves and other high-paying individuals, while keeping it out of the price range of the poor, who need these facilities just as much, if not more. With a single-payer system, there is no separation of facilities by price, and any efforts by the rich to make the system better create a better system for everyone. This combats the claim that the system would lower the quality of health care provided because the rich who are accustomed to top-notch care would still want that and work to make the whole system be as good as they had it before. A second benefit of this system is the elimination of the pre-existing condition problem. The pre-existing condition is where an individual is turned away from being provided health insurance or their rates are increased because they have a pre-existing condition that has the potential to cause more health problems later on in their lives. These people are the ones who need healthcare the most and are being denied or charged many times more than healthy Americans. The privatized insurance companies do not want to insure an individual like this because they will most likely lose the company money. In a single-payer system, the government would not be running it for a profit and would have no reason, or ability for that matter, to turn down anyone for any reason. According to healthcare.gov, people are now supposed to be protected from higher rates due to pre-existing conditions, but reform on the subject is far from complete. The system also simplifies the billing system that doctors and medical personnel are free to perform procedures and dispense medication faster when it is needed by the patients. Instead of having to figure out which provider they had under a privatized system, they already know what is going to happen and are able to start working essentially before payment is negotiated, because it doesn't have to be. This allows people in danger of death or other lasting injury to be treated faster and possibly more effectively. Prices for these procedures will also be lower because with everything now being government run, there is no need for a profit at the highest level such as CEO or excessive salaries for top workers. The single-payer healthcare system is used around the world successfully, most notably in countries such as Canada, the United Kingdom, and Switzerland. These countries all have zero uninsured citizens and are able to get all of their citizens good, reliable healthcare in a timely manner. This system is a very reliable and relatively cheap way to provide the country with universal healthcare that is both affordable and comprehensive.